So we are about to roll out the chloroquine trial, or the hydroxychloroquine trial, and it's in 2 arms. We have our own trial, the Lagos State trial, which is a double-blind, which means that you don't know whether you're taking chloroquine or you're taking a tablet that's full of chalk. They look the same. Even the doctors who are giving out the medication don't know which one is chloroquine and which one is chalk. So there is no bias whatsoever in the outcome. So when we are analyzing the data, only one person in that trial group will know who got chloroquine and who didn't get chloroquine. There is the WHO Solidarity trial as well, which we are also participating in. But it is not a double-blind trial. But we're going to participate in that as well. In one of our centers, we're going to roll out the WHO Solidarity trial on chloroquine. And at the end of maybe in about 2 months from now or a month from now, we should start to get some information out of these trials, how our people in Lagos are responding to the use of chloroquine, either as a prevention or as a treatment. So our trials are divided into 2. We're giving some drugs to some chloroquine to professionals, healthcare professionals, and to people who are in close contact with people who have COVID, to see that if we give you any of these drugs, does it prevent you from catching COVID-19? And if you do catch COVID-19 and we give you one of these clinical trial drugs, does it shorten the amount of time that you're unwell, or does it prevent you from going from mild to moderate to severe to critical to death? So if we are giving you a particular drug and compared to the group that are not getting the drug, there's a difference in the medical profile, then we can quickly conclude that this drug is actually effective in reducing the severity of the disease. So the question around COVID-19 phobia. I think this question was related to patients presenting at medical facilities, and the healthcare professionals are reluctant to see patients who are coming for other medical attention. So I think, as I said earlier on, everybody should be presumed COVID-19 positive, because there are so many asymptomatic people in community. And so if you come into a hospital with very mild symptoms of COVID, or even no symptoms of COVID, and you're coming for some other procedure, maybe you're pregnant, or you're coming for an operation, or you're coming for an extraction of your tooth or an eye examination, and you're an asymptomatic carrier, then you will transmit the virus inside the facility. So what we're doing with our personnel is, first of all, we're trying to make sure that if you're symptomatic, you will be examined before you enter the hospital, and if there is any suggestion that you have COVID-19, that will refer you to a COVID-19 hospital. If you don't show any signs of COVID-19, we are training our healthcare professionals to manage you as if you have COVID-19 while they're managing your other condition. So the doctors and the nurses and the healthcare professionals must be practicing a high level of infection prevention control, so that even if they're managing patients with COVID-19 who have other kinds of problems, that they're reducing the risk of that person transmitting the virus. So the patient themselves should be wearing a mask, so that they reduce, whether you know their status or not, they should be wearing a mask. Now very soon, we're going to be validating the rapid tests. We've started the process. We've identified several manufacturers of rapid tests, and once we've validated the rapid tests, then it's an added opportunity for us to rapidly screen people at the point of entry into any hospital. So it will take us 10 minutes to just perform a rapid test on you. And if the test is positive, then we know we can refer you for isolation. If the test is negative, then we have a higher confidence that you can go into that facility and get the care that you're looking for outside of COVID-19 disease. We can also use that rapid test to screen our healthcare professionals and find out how many of them have experienced COVID infection before. So if the test shows that you've had COVID because you have antibodies to COVID, then the healthcare professionals will be able to practice with more confidence in their healthcare facilities, knowing that they've caught COVID before and that they are very unlikely to catch it a second time. So we're very anxious to use those rapid tests so that we can use that to screen patients going into hospitals and use that also to screen doctors and nurses and also to screen all these returnees that are coming across our borders and through our international airports.